So today I'm reacting to wild animal attacks that ended badly. If you've ever wondered what happens to the human body when a person goes toe-to-toe with an apex predator, then you've come to the right place. Although claws, fangs, and rows of razor-sharp teeth are best left outside of the operating room, each of these stories offers us the opportunity to develop a deeper understanding of human anatomy.
Oh, really?
And thankfully, our first patient, Bethany Hamilton, survived her encounter with a 14-foot tiger shark, a testament to the resilience of the body and strength of the spirit. As we can see from her YouTube channel intro, Bethany is a professional surfer who lost her left arm in the attack. This occurred in 2003 when she was only 13, and since then, she has had plenty of success on her board. Her story was featured in a 2011 film entitled Soul Surfer, which we'll refer to for a reenactment of the incident.
Inside, they'll probably just tell us what to wear. I guess, but it's fun to think about.
An ominous shot from below, and I can't help but hear the Jaws theme song playing in the back of my mind. But before we move on, remember, not all sharks are dangerous. In fact, some of them have our best interest in heart. Interns, I'm proud to introduce today's video sponsor, Surfshark VPN. And while it may not be a real shark, it certainly won't back down from a fight. Imagine this fish bait is a hacker, casually trying to steal your data while you do some online shopping on the local cafe Wi-Fi. Bam! Surfshark VPN has got you covered, leaving you and I to go about our online business in peace. With Surfshark VPN, I don't even hesitate to use public Wi-Fi when I'm traveling. For example, if I need to buy last-minute tickets or find a place to stay. Technically speaking, they use encryption to make your browsing private, hide your IP or your internet protocol address, and stop your internet provider from tracking you. And so, to put it simply, see ya, hackers. And did you know Surfshark lets you stream shows or sports from other countries? Their VPN routes your internet traffic through a server in your chosen country. That is to say, change your IP address to, well, wherever you want. So you can travel the world in just one click. So maybe this is more accurate? Not to mention, one Surfshark account can be used across all of your devices. They have 24/7 live chat support and a 30-day money-back guarantee. Follow the link in my description to try Surfshark VPN out for yourself and use my promo code to get an extra 3 months on me. Now, let's see what happens when the shark isn't so nice. Please note that any trauma depicted in this video has been carefully contextualized within a lesson on human anatomy, as per YouTube's own community guidelines. Back to the tiger shark.
Can you believe we get to come out here every day? Yeah.
The tiger shark clamps down on Bethany's arm up to the shoulder or glenohumeral joint, which has several defining characteristics. Like our other large movable joints, the shoulder is synovial, where two bones are connected by a capsule filled with synovial fluid, allowing for smooth movement and cushioning between the bones. It is also what we call a ball and socket joint, a configuration that allows for complex articulation between the glenoid of the scapula and proximal humerus. But generally, as a joint becomes more mobile, it becomes less stable. This is especially true of the shoulder, where only a shallow portion of the ball is encased in the socket. More like a ball and saucer, to be more accurate. All this is to say that the bones themselves offer very little resistance to the strength of the shark's bite. The muscles, tendons, and ligaments present in the shoulder are on their own, but at least there is strength in numbers. You see, the glenohumeral joint area contains many structures like the rotator cuff tendons, supraspinatus, infraspinatus, teres minor, subscapularis, the biceps tendon, deltoid and latissimus dorsi muscles, as well as the ligaments, glenohumeral, coracohumeral, coracoacromial, and capsule that stabilize and enable movements of the shoulder. And even though most tendons and ligaments boast an impressive tensile strength between 50 to 150 MPa or megapascals, they're up against against more than raw pulling or tensile forces here. Several rows of razor-sharp teeth act like a saw as the shark shakes its head from side to side. According to AmericanOceans.org, a tiger shark also has the unique ability to rotate its jaw, which allows them to bite through tough prey such as sea turtles and even small whales. My apologies, sir. I had no idea I was in the presence of a giant swimming chainsaw. Medical attention is urgent following an attack of this magnitude, and Bethany is extremely lucky that she wasn't alone. In the moments that follow, she will be at acute risk of hemorrhagic shock. Hemorrhagic shock occurs when a person loses a significant amount of blood due to bleeding, causing a critical drop in blood volume and inadequate circulation of blood to the body's vital organs and tissues. Technically, it's a subtype of hypovolemic shock, which is a broader term that encompasses any situation where there is a significant loss of blood volume or fluids, leading to inadequate perfusion of organs and tissues. No matter how you slice it, when the vital organs and tissues, brain, heart, lungs, liver, for example, don't get enough oxygen and nutrients via the blood, the system starts to fail.
Dad, where's the shark at? We need to get to the reef. Just get to the reef.
At this moment, Bethany is in shock. Her fight or flight instinct is activated and excitatory chemicals like adrenaline and norepinephrine are released, allowing her to swim for her freaking life. Adrenaline makes us stronger and less sensitive to pain, while norepinephrine increases alertness, but once the danger has passed, the crash is inevitable.
Byron, you get the shore. Go, call 911.
As more blood is lost and blood flow to the brain decreases, Bethany begins to feel lightheaded. Her father uses his shirt to create a makeshift tourniquet for her shoulder to compress her torn blood vessels and minimize blood loss. Unfortunately, there are several large arteries that supply the arm with oxygenated blood: subclavian, axillary, and the largest among them, the brachial artery.
Stay with me, Bethany.
As she continues to lose blood, loss of consciousness is inevitable.
Alana, get over here.
Her father's decision to tighten the improvised tourniquet with an inelastic cord from the surfboard may have just saved her life, as it would provide a more consistent and direct pressure on the severed arteries. Once it is in place, it's a race against the clock to get Bethany to the emergency department.
Okay, lock her in.
Please don't die.
Got it, bro? Come on,
In the ambulance, the paramedics will monitor Bethany's vitals: heart rate, blood pressure, respiratory rate, and even oxygen saturation. They will also administer intravenous fluids, such as saline solution or a balanced electrolyte solution, or even blood, to restore the lost fluid volume and help increase blood pressure, and possibly even painkillers to prepare her for the surgery to come and to decrease her pain symptoms.
Where's my family?
They're on their way. They're gonna meet us at the hospital. She's going into hypovolemic shock. We're almost there.
But once hypovolemic shock sets in and the heart stops or Bethany loses consciousness, the ER is really the only hope. Back on her own channel, Bethany explains just how severe the blood loss was.
I lost about 60% of my blood, and it was just a miracle that I survived.
60% of the body's blood volume is a massive amount, and her choice of the word miracle is definitely appropriate here.
Traumatic amputation. Severe loss of blood. Blood pressure is 70 over 40 and dropping. Up.
Get her in here. Move. Come on.
A blood pressure of 70 over 40 is hypotensive. That is to say, dangerously low. And according to the flatline elongated beep we heard earlier in the ambulance, her heart has already stopped beating. Yes, we'd be running. Judging by the blurred vision point of view, the film suggests that Bethany is losing consciousness only now, though her heart stopped beating earlier. A patient may retain consciousness briefly, perhaps for a matter of seconds after the heart has stopped beating, but the time frame seems to have been extended here for dramatic effect.
Okay, so we're going to write it so that she loses consciousness at the exact moment she enters the operating room.
So technically, when the heart stops beating and a person loses consciousness, they are deceased. They're clinically dead. But there is a brief time frame wherein cardiopulmonary resuscitation, or CPR, and defibrillation combined can restore the heart's rhythm. In such cases, the term dead might refer to the absence of vital signs, but not necessarily irreversible biological processes, or biological death.
All my friends are dead.
Once Bethany is stabilized, the attending surgeon must quickly control the bleeding before anything else can be done. The makeshift tourniquet will be replaced, and large visible blood vessels will be clamped shut. Bethany will continue to receive IV fluids and will likely require a blood transfusion to replace what has been lost. In the past, crystalloid fluids such as normal saline, a salt solution with properties similar to our blood plasma, was used. But studies have now shown us that there is no better replacement for lost blood than more blood.
She's going to have any chance at all, she'll need more blood.
Since Bethany's injury involves the complete loss of her arm without any chance of reattachment, the attending surgeon will clean the wound, remove non-viable tissue, and possibly prepare for further reconstruction or prosthetic attachment.
I started surfing about 3 weeks after. I got up on my 3rd wave, and pretty much right then I knew I'd be surfing.
In some ways, the recovery time after an injury like this could be shorter than, say, a total knee reconstruction or replacement, or a severely broken bone. There is less risk of re-injuring something that is in the process of healing, except the skin in Bethany's case. Tending to the sutures that close the wound and keep bacteria out is essential in order to avoid infection. If all goes well, Bethany will likely get her stitches out in about 2 weeks. That being said, she must now adapt to life with only one arm, and that could potentially take a lifetime, given the intertwined physical and psychological components involved. Bethany's recovery is a testament to her strength, willpower, and character. Remember to follow the link in my description to claim an extra 3 months on Surfshark today, an excellent VPN solution for all of your devices with 24/7 support and a 30-day money-back guarantee. If you liked the video, be sure to subscribe and give it a thumbs up. And if you didn't, be sure to let me know why in the comments section down below. And don't forget to subscribe to my online gym, Hugo 2.0 Fitness, for free right here on YouTube, where we help you to move better and prevent injury. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.